Talking about these questions and the lecture. You know that in the leg we have two bones, tibia in the medial side, fibula in the lateral side. Between these two long bones we have membrane, interosseous membrane. As I told you, we have three compartments in the leg. Anterior compartment, posterior compartment. Yes, posterior has two layers, and lateral compartment. So these are three compartments: anterior, posterior, and lateral compartments in the leg. So anterior compartment, what is the action of the muscle? What is the nerve? Lateral compartment, what is the action of the muscles? What is the nerve? Posterior compartment, what is the action of the muscles? What is the nerve?
Anterior compartment,
Deep fibular nerve or deep coronal nerve. Action of the muscles. Extension. No, it's enough. Anterior compartment is correct.
Posterior compartment, innervated by the tibial nerve. The main function is plantar flexure. The lateral compartment.
No, it's enough. Posterior, lateral.
lateral nerve, superficial pyramidal nerve, and action
Flexion plantar.
Eversion, yes, eversion. Very good.
action دكتور فورمصل dorsiflexion أو full.
Very good. Dorsiflexion and extension and inversion. Posterior compartment. Plantar flexion, inversion, flexion of the muscles. Lateral compartment. Two muscles, they do eversion, and the nerve. So look at here. Generally, we should know the compartments, action, and the nerves. Then we're talking about each muscle. Anterior compartment, the muscle here. What are the name of the anterior compartment muscle? We have four muscles. One muscle in dorsal side of the foot, 5. But in anterior compartment of the leg, we have four muscles. What are the name of these muscles?
Tibialis anterior, extensor digitorum longus, extensor digitorum brevis, extensor hallucis longus.
Longus and one? Pronus tertius, yes. Four muscle in anterior side of the leg, one muscle in dorsal side of the foot. Anterior side of the leg, tibialis anterior.
So 5.
Yeah, one in dorsal side of the foot, 5, yes. Tibialis anterior. Extensor digitorum, yes, anterior compartment, they extend. So the name of the muscles are extensor. Extensor digitorum longus. Extensor hallucis longus. Pronus tertius. And one muscle in dorsal side of the foot, extensor digitorum brevis. What is pronus tertius and why we say that? Pronus tertius. What is the meaning of tertius? Why this name in anterior compartment? We know that in lateral compartment we have two muscles. Pronus means fibularis. Fibularis longus, fibularis brevis. Fibularis longus, fibularis brevis. You can say pronus longus, pronus brevis. Okay. So why in anterior compartment we have one muscle? The name of this muscle is pronus tertius. Fibularis tertius. Why? Fibular muscle, they are in the lateral compartment. Any idea? Any?
I think it's a small muscle, maybe.
Yes, it's small, but the name doesn't show you the size of the muscle. Origin from fibula. Okay? What is the meaning of tertius? Pronus tertius. Tertius means number 3. Third one. Number 3. So this is the third fibular muscle. Yes. Third fibularis muscle or third fibularis muscle. In the lateral compartment we have fibularis longus fibularis brevis. In anterior compartment, you have the third fibularis, fibularis tertius. So tertius means number 3. And these muscles, all of the fibularis muscles, fibularis longus, fibularis brevis, fibularis tertius,
Everate the foot.
they start from fibula and they evert the foot, not invert, evert. So for this reason, they have same name. Fibularis longus, fibularis brevis, fibularis tertius. They evert the foot and they are started from fibula.
دكتور بيرونيوس تيتروسي دكتور just muscle origin and insertion.
Origin from the leg, from the fibula, insert to the base of the fifth metatarsal bone. So we'll be talking about the origin and insertion. So this is the general shape of the leg. 3 compartments, you should know, 3 innervations. Here, deep fibular nerve. Here, posterior compartment, tibial nerve. Lateral compartment, superficial fibular nerve or pronal nerve. Okay? So another question. What are the blood supply for each compartment? For each compartment. Anterior compartment,
anterior tibial artery.
posterior compartment,
Posterior tibial artery.
lateral compartment, fibular artery. So these are the blood supply. Anterior compartment, anterior tibial artery is a branch of popliteal artery. Posterior compartment, posterior tibial artery is a branch of another branch of the popliteal artery. Lateral compartment, fibular artery is a branch of posterior tibial artery, has another branch, fibular artery. So these are general information about the leg, the summary about the muscles, nerve, and function. We talked about superficial veins, like upper limb. In the lower limb, we have an arch, plexus, dorsal side of the foot, dorsal side of the hand, and dorsal side of the foot. We have superficial veins. They are superficial, in superficial fascia. So they are not close to the artery. Artery, they are deep. Tibial artery, popliteal artery. We have popliteal vein, tibial vein. These are deep vessels. But these are superficial. Look at the arch. Dorsal venous arch. Dorsal side of the foot, not plantar side. Dorsal side of the foot. When you stand it, when you see on your foot, you can see some vessels. These are superficial veins. So we can use that for injection. These are veins. From this arch, from medial side, one big vein starts and goes up. Great saphenous vein. Superficial vein in medial side of the foot, medial side of the leg, medial side of the thigh, and finish here. Very good. Saphenous opening and terminates in which vein?
Femoral vein.
Femoral vein. So goes up and finish here in the femoral triangle, saphenous opening in the femoral vein. Another one, lateral side of the arch. A small saphenous vein. Start from lateral side of the arch, goes behind the leg, goes up, and finish in the popliteal vein. So what is the difference about relation to malleolus?
Great saphenous vein goes anterior to the medial malleolus, while small saphenous vein go behind the lateral malleolus.
Very good. Look at the picture. Great saphenous vein is anterior to the medial malleolus, but a small saphenous vein is posterior to the lateral malleolus because it goes to the posterior compartment. So you can use great saphenous vein for injection. Sometimes you use median cubital vein for injection, infusion of drug medicine in the hospital. But after 1 week, 2 weeks, this patient is in the hospital. You can use this vessel. These are weak now. You can use this vessel How I can find great saphenous vein? Find medial malleolus. You can touch it. Okay. Anterior to that. If you be a little,
Skin.
yes, you can see a vessel anterior to the medial malleolus. Then you can inject here in the great saphenous vein. Yes.
Dr. Swan accompanies small saphenous vein.
Very good.
Dr. Saphenous nerve in the front of the greater saphenous vein.
Very good. These superficial veins, great saphenous and a small saphenous vein, we have one superficial nerves. Superficial nerves means sensory nerve because it's superficial, close to the skin. So this is sensory, yes, for the skin. For great saphenous vein, we have one sensory nerve. Saphenous nerve, it's here. Medial side of the knee, medial side of the leg, medial side of the foot. The name of this nerve is saphenous nerve. For a small saphenous vein, we have sural nerve. Posterior side of the leg and lateral side of the foot. So, accompanied means they are passing together. Okay? We had the first question, all of the following sentences are correct about superficial vein, except it's not correct that sural nerve accompanied great saphenous vein. It's not correct. Because saphenous nerve accompanied great saphenous vein and sural nerve accompanied a small saphenous vein. So where is the origin of the sural nerve?
Tibial.
Tibial nerve. It's sensory nerve start from tibial nerve in the popliteal fossa. And the action of this sensory nerve goes to the skin, posterior side of the leg, and lateral side of the foot. Where is the origin of the saphenous nerve? Femoral nerve. Yes, femoral nerve. Posterior division of the femoral nerve goes to the medial side of the knee, medial side of the leg, medial side of the foot. Saphenous nerve. So it was the first question. Look at the nerve accompanied the superficial veins. This is a small saphenous vein. The nerve is sural nerve, sensory nerve. Sural nerve for posterior side of the leg and lateral side of the foot. We had another question. What is the sensory nerve? Sensory nerve. For lateral side of the foot. Sural nerve. I can ask this question in another form. What is the sensory nerve for most medial side of the foot? Saphenous. The most medial side of the foot, saphenous. The most lateral side of the foot, sural nerve.
Doctor,
Yes.
two questions.
Yes, I will tell you. I told you, what is the sensory nerve for lateral side of the foot? Sural nerve. What is the sensory nerve for medial side of the foot? Saphenous nerve.
Dr. Swan intended Dr. lateral side, lower half.
Yes. Center of the leg and lateral side of the leg and lateral side of the foot. It's very long nerve. So look at the great saphenous vein. You can see saphenous nerve. Sensory nerve for medial side of the knee, medial side of the leg, medial side of the foot. Anterior and lateral side of the leg, sensory innervation. So look at the picture. I told you the medial side of the leg, medial side of the foot, saphenous nerve. So it's easy. Saphenous nerve for medial side of the knee, medial side of the leg, medial side of the foot. Okay, here. look at the anterior and dorsal side of the foot. Anterior and dorsal side of the foot. Most part of this region, you can find superficial pronal nerve or superficial fibular nerve. Look at the yellow color. Superficial pronal nerve. Except one place.
Between
The cleft between the great toe and second toe. Deep pronal nerve. Okay? So, the question, what is the origin of this nerve? Superficial fibular nerve, deep fibular nerve, how they coming here, how deep fibular nerve coming here between the cleft. Common fibular nerve. So, you know that. Sciatic nerve is for posterior side of the thigh, the largest nerve in the body. Okay. Superior or proximal to the popliteal fossa, sciatic nerve divides to the two nerves. Yes. Tibial nerve for posterior side of the leg, common fibular or common pronal turns and go to the lateral side of the leg. Common fibular or common pronal turning around the neck of the fibula. Neck of the fibula. Here divides to the two nerves, two branches. Superficial fibular and deep fibular nerves. So here you have a difference. Superficial fibular and deep fibular, I told you, they are a branch of common fibular. Superficial fibular for lateral side of the leg, superficial fibular nerve. Deep fibular nerve for anterior side of the leg, muscular system. I'm talking about motor function. So the muscle in lateral side of the leg, they have superficial fibular nerve. The muscle in anterior side of the leg, they have deep fibular nerve. We had questions. What is the motor supply for lateral compartment, anterior compartment? You know that. Lateral compartment, superficial fibular nerve. Anterior compartment, deep fibular nerve. What is the sensory actions? Look at here. Superficial fibular nerve, after innervates muscle, becomes sensory. Go to the superficial fascia, close to the skin. So, innervate the anterior side of the leg, lower part of the anterior side, dorsal side of the foot. So this is superficial fibular nerve sensory functions. How about deep fibular nerve? Innervates the anterior compartment muscle, then goes to the dorsal side of the foot. Here innervate 1-2 muscle here, extensor digitorum brevis, extensor hallucis brevis. After that becomes sensory. It's here, just here. Cleft. What is the meaning of cleft? Yes. What do you say, Nabi? Yes. It's like this. Okay? For example, when earthquake happens, you can see some line opening in the wall. This is the meaning of cleft. Okay? So just the cleft between great toe and second toe. This region just for deep fibular nerve sensory function. We had one question. A cleft between great toe and second toe. What is the sensory nerve? Deep pronal nerve. And I told you, the most medial side of the foot, saphenous nerve, most lateral side of the foot, sural nerve. This is a sensory function. You can see in the picture. It's not very difficult. Look at the picture. So we had another question. Which nerve has infrapatellar branch? Infrapatellar branch of the saphenous nerve. Saphenous nerve in medial side of the leg, it has one branch, goes to the patella. Patellar region, patellar ligaments. Sensory. So infrapatellar branch is the name of this nerve from saphenous nerve. Saphenous nerve supplies the medial side of the leg, medial side of the foot, lateral cutaneous nerve of the calf, lateral side here. Who can explain this? Lateral cutaneous nerve of the calf. What is the origin? What is the place? What is the action? What is the anything you know about that? Lateral cutaneous nerve of the calf.
Common,
Yes. I told you, previous session, posterior side of the leg, tibial nerve is for muscles. Okay. Tibial nerve has two sensory nerves. One, sural nerve, another one,
lateral cutaneous.
very good, medial calcaneal nerve. So, sural nerve is a sensory branch of tibial nerve, and medial calcaneal branch of the tibial nerve. It's very important for the sense of the heel here. Sense of the heel. Medial calcaneal nerve. Common fibular start from here, goes to the lateral. But before goes to the lateral, it has two sensory nerves. Sural communicating, attached to the sural. Sural from tibia, but sural communicating from fibula. So sural communicating, okay. And this one, lateral cutaneous nerve of the calf, is the second branch of the common fibular nerve in posterior side of the leg. So what is the action? Lateral side of the skin in the leg. Goes here.
About here.
Yes, it's here. You can see common pronal. What is the branch of common pronal? Lateral cutaneous nerve of the calf. So this is the origin, and you can see the function.
Common fibular nerve has two branch motor and two sensory. Recurrent and the superficial and deep is motor, and sural and lateral sural is.
So,
Yes.
sural communicating and lateral cutaneous nerve of the calf are sensory. But superficial fibular nerve and deep fibular nerve, they are both sensory and motor. You know that? Superficial fibular nerve, motor for the lateral side of the leg, sense of the here. Deep fibular nerve, anterior muscle, and here. So they are both motor and sensory.
How about medial cutaneous nerve of the calf?
Medial cutaneous nerve of the calf, we don't have this. We don't have this nerve because we have saphenous nerve. We don't have any nerve by this nerve, by this name. Okay? We don't have. We have lateral cutaneous nerve of the calf, but we don't have anterior, medial. Okay? So look at here. Dorsal side of the foot. Because anterior compartment, it's related to the dorsal side of the foot. We should talk about dorsal side of the foot here. Look at here. SPN means superficial pronal nerve. Superficial fibular nerve or pronal nerve. Anterior side of the leg in lower half. Dorsal side of the foot, most part of this region. Superficial fibular nerve. Just this cleft, deep pronal nerve or deep fibular nerve, okay? And I told you, the most lateral part, sural nerve. Sural nerve from posterior side goes to the lateral side. The most medial side of the foot, saphenous nerve. So this is the sense of the dorsal side of the foot. Look at here. Common pronal nerve, common fibular nerve goes to the lateral side of the knee, turning around the neck of the fibula. Neck of the fibula turning. And you can see here divides to the two branches, superficial and deep pronal nerve. We're talking about the actions here. Sural nerve, close to the small saphenous vein. I told you everything about this, but look at here, from posterior side of the leg, goes to the lateral side of the foot. This is the place. Yes, lateral side of the foot. So deep peroneal nerve, just this cleft. Here is sensory. So in this picture, you can see all of the sense of the lower limb. Anterior view, posterior view. As you can see, lower limb has a lot of sensory branches. It's not like upper limb. Upper limb, it was easier. For example, in the forearm, medial cutaneous nerve of the forearm, lateral cutaneous nerve of the forearm, posterior cutaneous nerve of the forearm. It was the sensory branches. But look at the leg, yes. Saphenous, sural communicating, superficial, fibular. These are all of the branches here, or in the thigh. You can see all of the nerves. So let's talking about retinaculum. I told you in the upper limb. Here we have one flexor retinaculum. Here one extensor retinaculum. What is the action of the retinaculums?
Protect the structure beneath it.
Protect and yes, hold them in correct place. Imagine here we have muscles. The muscles attached to the fingers. So when you flex, this muscle work here. So if you don't have any coverance or one part hold this tendon, when you flex or when you hold something, so the tendon goes up, down. So they attach the tendons to the tunnels, to the bones. Yes, to the arch. This is the function of the retinaculum. In the foot, we have 5 retinaculums. 2 extensor, 2 fibular, and 1 flexor. Let's start with extensor retinaculum. Superior and inferior extensor retinaculum. The blue color is superior. This green color is inferior. As you can see, the inferior extensor retinaculum is Y-shaped. Y-shaped. So it was one question. Which retinaculum in the foot is Y-shaped? Inferior extensor retinaculum. Look at the superior. Start from anterior side of the tibia attached to the anterior side of the fibula in the lower part and protect the tendons. Which tendons? Muscle of the anterior compartment. Tibialis anterior, extensor hallucis longus, extensor digitorum longus, pronus tertius, artery and nerve in anterior compartment. What is the artery? Anterior tibial artery. What is the nerve? Deep fibular nerve. So these 4 muscle, 1 artery, 1 nerve. They are protected by extensor retinaculum. Okay? Look at the inferior extensor retinaculum. Start from here. The stem of the retinaculum start from the calcaneus. What is the meaning of a stem? No. No. Roots means. But this one means sab. Yes. The stem means. In Farsi you say sab. In Arabic you say. Oh, it's here. You know that the plant. This is root. This place. Okay. A stem. So the stem of the Y shape is here. This is the stem. The stem attached to the calcaneus. Attached to the lateral side of the calcaneus. Then divides to the 2 parts. Upper part, lower part. Upper part attached to the medial malleolus. Lower part, as you can see here, attached to the plantar aponeurosis, goes to the plantar surface. So, here we have one important question. You should know the order. What we have behind the extensor retinaculum? From lateral to medial. Can you tell me? From lateral? No, from medial to lateral. Anterior.
Anterior tibial artery.
No. No, you missed that. Then?
Tendon of polycis.
Anterior
Vessel, anterior tibial artery.
Okay.
وين انت
Nerve. Deep peroneal nerve.
Pay attention, guys.
structure pyramidal version والdeep pyramidal nerve anterior tibial spasms extension digital longus extension hallucis longus.
No. He said from lateral to medial, but one drawing.
Doctor, from medial to lateral.
Medial to lateral.
Tibialis anterior, extensor hallucis longus, extensor digitorum longus,
Anterior tibial artery.
artery, yes, and
So look at here. Yes. After extensor hallucis longus, you have artery nerve. Then extensor digitorum longus, pronus.
fibularis tertius.
Yes.
لا بيرونيال
So look at here, guys. It's important. The structure you have here behind the extensor retinaculum from medial to lateral or lateral to medial doesn't matter. I tell you from medial to lateral. Tibialis anterior, extensor hallucis longus, then artery. Anterior tibial artery, then nerve, tibial nerve, then extensor digitorum longus and pronus tertius. These are 6 structures behind the extensor retinaculum from medial to lateral. Tibialis anterior, extensor hallucis longus, anterior tibial vessel means anterior tibial artery and vein. Deep peroneal nerve, extensor digitorum longus, pronus tertius. The question today it was, what is the lateral structure to the extensor hallucis longus?
anterior tibial
Anterior tibial artery.
Individual exam.
Yes, it was one question. So why it's important? Why we had it in the exam?
The artery and vein before hallucis.
Before hallucis. No. How it's possible? This is extensor hallucis longus. This is artery. So artery is lateral.
One muscles, artery, nerve, then two muscles.
No. 2 muscle, then artery, then nerve. So why it's important?
The location is related to the place of insertion.
Yes.
For example, tibialis anterior is into the medial
Yes.
side.
Yes.
Yes.
Attached to the medial coniform,
Coniform.
base of the fifth metatarsal bone. Yes. So pay attention. Why the location of anterior tibial artery is important? Because here a place you can check the pulse again. I told you you can check the pulse, heartbeat easily by the neck. This is larynx, angina here, larynx. You can put your finger lateral to the larynx. Easily you can check that. Larynx, lateral to that. So this is the first place. It's very easy to check the pulse, heartbeat. Second one, upper limb, lateral side of the wrist by radial artery. We talked about that in the upper limb. The third place is here. You ask, it's very difficult to find, but this is the third place. Easier is here. Then here, then you can check that here. How you can find it? You ask the patient to extend the great toe. He or she extend the great toe here. When extend the great toe, you can find the tendon. You can find the tendon. This is the tendon.
Lateral to the tendon is
So then put your finger lateral to the tendon. Okay? You ask the patient to extend the great toe. You can see the tendon easily, goes off. Then put your finger lateral to the tendon. Here you can check the pulse. This is one place. Check the artery, heartbeat, pulse. So, the order is important, you should know that. Maybe I ask you in the final exam, what is the most lateral structure behind the extensor retinaculum?
Peroneus tertius.
Pronus tertius. What is the most medial?
Tibialis anterior.
I told you, for example, in final exam, I can ask you, what is the lateral, most lateral structure behind the extensor retinaculum, pronus tertius. Or any other question? Yes?
What's about this region?
This region, very good question. This region, we have superficial veins, cephalic vein, basilic vein. Here they have connection. Between cephalic and basilic vein, we have connection.
Medial.
Median cubital vein. Cephalic, basilic, this vein, median cubital vein. So this is superficial vein. You can't check the pulse by vein. You check the pulse by artery, because artery coming from the heart show you the pulse. So this is artery, here is artery, here is artery. We use veins for injection, usually superficial veins. So you can inject medicine here. You can take blood sample here, okay? This is superficial vein. Pronal retinaculum or fibular retinaculum. We have two retinaculum for the fibularis muscle, fibularis longus and fibularis brevis. Look at here. Here is lateral compartment. Lateral compartment. In lateral compartment, we have two muscles. Fibularis longus or pronus longus, pronus brevis. These two muscles, where is the insertion of these two muscles? Pronus brevis.
Base of metatarsal number 1.
Very good. Base of the metatarsal number 5, fibularis brevis. This is fibularis brevis. Attached to the base.
Two insertion.
Pay attention. Fibularis longus and brevis, the insertion is important because show you the action. Fibularis brevis attached to the here, lateral side, base of the fifth metatarsal bone, finish. But fibularis longus,
Attached to the cuboid bone and the first metatarsal.
First,
how it's possible?
Because it goes into the plantar cervix.
Medial
Yes,
to-
look at here. Fibularis longus, from lateral side come to the medial side. From lateral side comes to the medial side and attached to the medial side of the plantar surface. So goes down, then from plantar side goes medial. So these two muscles, fibularis longus and brevis, in lateral side of the foot, they have two retinaculum. One here, superficial pronal retinaculum. One here, superior pronal retinaculum, inferior pronal retinaculum. These are two retinaculum. Look at the superior pronal retinaculum. Start from lateral malleolus and attach to the lateral side of the calcaneus. Hold these two tendons, attach them to the bones. Look at the inferior pronal retinaculum. Start from calcaneus and attach to the again close to the plantar surface. It's here. Start from this region anterior to the lateral malleolus and attach to the lateral side of the calcaneus, close to the plantar surface. But look at here, the inferior pronal retinaculum is very close to the Y.
To the stem of
Yes.
the inferior
I
extensor.
told you, very good. Inferior extensor retinaculum. Here, this Y shape. This Y shape, inferior extensor retinaculum. Look at here, this Y shape. So this retinaculum is here, close to the stem. Again, look at the picture. Inferior pronal retinaculum is close to the Y-shaped retinaculum. Inferior extensor retinaculum. So, as answer to this question, I don't have the name of the muscle. Okay. I can't see the insertion. I don't have the insertion. How I can tell that? Which of them is fibularis longus? Which of them is fibularis brevis?
front is not behind is
Again,
in front.
front, longus,
Yes. And behind it's
Perfect.
Exactly opposites. Exactly
Yes.
opposite. Yes, brevis is anterior, longus is posterior. Because brevis finish here, attached to the base of the metatars, but longus should go down, it's behind that. It's longer, start from upper. This is the arrangement. So look at here, tendon of the fibularis brevis, or peroneus brevis and peroneus longus.
Longus medial conform.
It's better to say anterior and posterior. Brevis anterior, longus posterior. Okay, longus posterior, brevis anterior. You can see in the picture. So the longus is posterior, this is longus. Brevis is anterior, this is brevis. Look at the brevis attached to the base of the fifth metatarsal bone, base of the fifth metatarsal bone. Flexor retinaculum is also important. We talked about that in the previous session. Look at here, bro. Where is the location? Medial side of the foot.
Anafromedial.
Pay attention.
Anafromedial side.
Yes. Start from medial malleolus. Okay. Attached to the medial side of the calcaneus. So this is flexor retinaculum. It's here. Flexor retinaculum. Look at this tunnel. Look at this arrow. A structure from posterior compartment goes to the plantar surface. From posterior compartment goes to the plantar surface. This tunnel is tarsal tunnel. Tarsal tunnel. So what is the structure inside of this tunnel? From lateral to medial, it's important.
From lateral to medial, right? Tendon of the flexor hallucis longus, tibial nerve, posterior tibial artery along with his terminal ends, along with the accumulating vines, tendon of the flexor digitorum longus, tibial posterior.
Very good. Very, very good. Yes, exactly. From lateral to medial, all of these tendons. Okay? Very good. For medial to lateral, I tell you in medial to lateral. Tibialis posterior. Flexor digitorum longus. Then artery. Posterior tibial artery. Then nerve. Tibial nerve. Then flexor hallucis longus. He said from lateral to medial. Okay? So we have these 5 structures. So it was one question today. What is the most lateral structure, I guess, inside of the tarsal tunnel? So lateral is flexor hallucis longus. Medial, tibialis posterior. And you should know the order. It's here. You can see from medial to lateral. Tibialis posterior, flexor digitorum longus, posterior tibial artery, tibial nerve, and flexor hallucis longus. All of these 5 structures coming from posterior compartment, and they go to the plantar surface. Tarsal tunnel syndrome, I told you. The only nerve we have in the tarsal tunnel is tibial nerve. So if this nerve compressed in the tunnel, this problem is tarsal tunnel, like carpal tunnel for median nerve. Here we have tarsal tunnel. The patient feels pain in the plantar surface, muscles are weak. These are the significant.
بس خليه يقول ريست نطفي خليه يقول ريست يا دكتور ريست يقول.
Let's continue 10 minutes, then we have rest to 10. So, Let's talking about the muscles. Let's talking about the muscles. So anterior compartment, muscles in anterior compartment, and dorsal side of the feet. So in anterior compartment we have four muscles: tibialis anterior, extensor digitorum longus, extensor hallucis longus, proneus tertius. I told you the story about this name.
The third.
Yes, the third. Tertius means the third one. So let's start with tibialis anterior. You know this point. Anterior border of the tibia, anterior border of the tibia, and medial surface of the tibia is, again, anterior border of the tibia and medial surface of the tibia is
Medial side do not have any.
bones doesn't have any muscle. It means they are subcutaneous. After skin you have bone. You can touch it. Anterior border and medial surface. So when you're talking about the muscle in anterior compartment, you should know that. We don't have any origin from medial side, anterior side. All of them from lateral side. Okay? So tibialis anterior. Start from lateral condyle of the tibia, lateral surface of the tibia, and interosseous membrane. Start from here. Tibialis anterior. The muscle goes down and attached to the
Medial coniform.
medial coniform and
The first metatarsal.
base of the first metatarsal. So origin and insertion. Look at the table. Start from lateral condyle of the tibia, lateral surface of the tibia, interosseous membrane. I
فوق
told you.
مصل التوسط membrane.
Yes, it's anterior compartment, so they also attach to the interosseous membrane.
Except extension digitorum brachius, no.
Because it starts from foot, not from leg. So look at the insertion. Medial coniform and the base of the first metatarsal bone. All of the nerve in anterior compartment and dorsal side of the foot, they have deep coronal nerve. All of the muscles. So, okay, look at the action. All of these muscles in anterior side of the leg, they can do dorsiflexion. Dorsiflexion. In posterior compartment, I told you they do
The plantar.
plantar flexion. Here in anterior compartment, I say dorsiflexion. So dorsiflexion, okay. Invertor of the foot means invert the foot. Like tibialis posterior, tibialis anterior, invert the foot.
Just two muscle do inversion.
Very good. Just two muscle inverts the foot. Tibialis
Anterior
posterior,
and posterior.
tibialis anterior. How many muscle invert the foot?
Three.
Three muscle. Fibularis longus, fibularis brevis, and fibularis tertius. So three muscles invert, two muscle invert. Maintain the longitudinal arch, medial longitudinal arch. Yes, all of the muscle attached to the medial side of the foot, they're helping the medial arch of the foot. Next session, Tuesday, we're talking about plantar surface. We're talking about foot muscle. Again, I explain for you. Medial arch of the foot. Next, extensor digitorum longus. Again, start from lateral side of the tibia, lateral condyle of the tibia. Also attached to the proximal part of the fibula and interosseous membrane. So start from tibia and fibula. A little goes lateral, attached to the tibia and fibula. Look at the picture. This muscle is extensor digitorum longus. Start from here and here. Lateral condyle of the tibia upper part of the fibula, extensor digitrum longus. Because we say digitrum, it means attached to the toes number 2, 3, 4, 5. 2, 3, 4, 5. 4 lateral toes, not to number 1. 2, 3, 4, 5. So extend the toes, digits. The name of the muscle is extensor digitrum. How they attach to the phalanges, I told you, like upper limb, we have extensor expansion. It's very wide tendon attached to the phalanges, middle and distal phalanges. Here again we have this. Look at the picture. This is extensor expansion. It's wide shape attached to the middle phalanx and distal phalanx. This is the second muscle. Extensor digitrum longus. Next. Extensor hallucis longus. Start from the fibula and interosseous membrane. Middle one half of the fibula and interosseous membrane attached to the distal phalanx of the great toe. Look at here. This muscle. Extensor hallucis longus. It's here. Extensor hallucis longus. Look at the origin. I start from here.
Middle one half.
Yes. So, extensor hallucis longus, start from fibula, middle one half of the fibula, attached to the great toe, extensor hallucis. And because it's long, so attached to the distal phalanx. Extend the great toe, extensor hallucis longus. Finally, pronus tertius. Pronus tertius, or you can say fibularis tertius. Look at the origin. Let's start again from the fibula and interosseous membrane, but lower 1/4. 1 from 4 parts, lower 1/4. Attached to the base of the 5th metatarsal bone. So base of the 5th metatarsal bone, we have 2 muscles.
Perennius brevis and perennius tertius.
Yes, both of them. Fibularis brevis and fibularis tertius. Both of them attached to the base of the 5th metatarsal, and they can evert the foot. Nerve is same, and look at the action. All of them, they do dorsiflexion, and this one also can evert the foot. So in anterior compartment, we have one muscle, it can evert. Pronus tertius. It was one question. Or I can ask you this question in another type. Which evertor, which muscle can evert the foot, is not innervated by superficial fibular nerve?
Pronus tertius.
Pronus tertius, because it's anterior compartment, the nerve is different. But they two, fibularis longus and brevis, because they are in lateral compartment, the nerve is different.
Superficial.
They receive superficial fibular, but this one, it's evertor, yes, but it receives deep fibular. It's very deep understanding. I told you which evertor of the foot don't innervate by superficial fibular nerve. So what does it mean? Superficial fibular nerve is for lateral compartment. So these two, they can evert. We have one muscle in anterior compartment, pronus tertius. It also can evert, but the nerve is different. Okay, the nerve is different. Pronus tertius, look at the picture. Lateral side of the extensor digitrum, it's here. This is a small muscle. I start from lower part of the fibula, attached to the base of the 5th metatarsal bone. It can dorsiflex and evert. Innervation, deep fibular nerve. Tertius means number 3, pronus tertius. And this last muscle in the table, Extensor digitorum brevis. It's not normal muscle. It's not normal muscle. Who can tell us why it's not normal muscle?
Because it inserts into the base of the great toe.
Extensor.
Medial 1/4. Medial
1 to 4.
Yes.
Because it originates on the insertion and in the
So this is, yes, very good. Both of the answers are correct. Look at here. This muscle, it is one muscle. It's one muscle. Look at here. This muscle here, it's one muscle. The only muscle in the dorsal side of the foot, intrinsic muscle. It means intrinsic means a start and finish in the foot. It's not a start from the leg, then go to the foot. No, origin and insertion in the foot. So it's intrinsic.
What about extensor hallucis brevis?
So I will explain that. So pay attention again. In dorsal side of the foot, we can see just one muscle. Other structure are tendons. Tendons of the anterior compartment. So they are extrinsic. This one intrinsic. Look at this muscle. Extensor, yes, it can extend. Dorsal side of the foot. Digitorum, okay. Brevis, it's short. Brevis. But I told you, always in the upper limb and lower limb, when you hear the name of the digitorum, means finger number 2, 3, 4, 5.
But this,
Except number 1. 2, 3, 4, 5.
this muscle 1, 2, 3.
Yes, but this muscle is exception. You say digitorum, but it's not attached to the number 2, 3, 4, 5. Attached to the number 1, 2, 3, 4. Yes, 4 fingers, but start from 1. 1, 2, 3, 4. But other digitorum, upper limb, lower limb, when we say digitorum means 2, 3, 4, 5, because always finger number 1, they have a specific muscle.
Digit 5.
Yes. Yes, from number 12 to number 5. So what happened here? This one muscle, extensor digitorum brevis, has one part attached to the great toe. Yes? Yes. 1, 2, 3, 4. So one part of the muscle attached to the great toe. We had this rule. If one muscle attached to the great toe, you should say hallucis.
Yes. Some
So now you can say this part of the muscle is extensor hallucis brevis.
at the same time, it is extensor digitorum brevis.
Yes. So when you say extensor digitorum brevis now, it's for finger number 2, 3, 4. Or it's better to say toes. Toes number 2, 3, 4. How about number 1? It has one part attached to the number 1. Now you should say extensor hallucis brevis. So this is the story. What happened? Extensor hallucis brevis and extensor digitorum brevis. It was one muscle attached to the toes number 1, 2, 3, 4. But to number 1 we say extensor hallucis brevis. To number 2, 3, 4 we say extensor digitorum brevis. So it's not normal. It's not typical condition. And what is the innervation? Yes, like anterior compartment. Here again, deep peroneal nerve. Look at the origin. I start from calcaneus, superior surface of the calcaneus, attached to these toes. Innervation, deep fibular nerve. And look at the names: extensor hallucis brevis, extensor digitorum brevis. We have the longus here, extensor digitorum longus, extensor hallucis longus. But the brevis, the shorts are,
And the longus are extrinsic.
yes,
The brevis intrinsic.
are here. Did you get that? So, look at this picture. I told you why extensor hallucis longus is important. You can check the pulse, heartbeat. How you can check that? Ask the patient to extend the great toe. Then find the tendon, extensor hallucis longus. Then put your finger lateral to the tendon. You can find dorsalis pedis artery. The continuation of anterior tibial artery in dorsal side of the foot.
ankle joint change the
Very good. Yes, after malleolus or in front of the ankle joint here, anterior tibial artery, the name changed to the dorsalis pedis.
between two malleolus.
Yes, because it's dorsal side of the foot. Pedis, pedals means foot. Dorsalis pedis. Humans are bipedal, means they are walking on the two foot. Okay, bipedal. Pedis means foot. So we can have rest. We start at 10. We continue the lecture, and because until 12 we have theory, then I talk about joints of the lower limb, because Tuesday we just have 2 hours.